Type 1 diabetes, which used to be called juvenile diabetes or insulin-independent diabetes, is an autoimmune disorder. It's no longer referred to as insulin-dependent or juvenile onset because it's a type of diabetes that can occur at all ages. While it does occur the most in young people and teenagers, early 20s, it is a disease that can occur at any age, so that we got rid of the name juvenile onset. And insulin dependency can occur in several other types of diabetes, so we got rid of the name insulin dependent. So we now call it type 1 diabetes. It is the more severe type of diabetes. It occurs in 5 to 10% of the population with diabetes. It is an autoimmune disorder in which the beta cells of the pancreas are destroyed by the immune system. The beta cells of the pancreas are the cells that release insulin. And so as a result of it, there is an absolute lack of insulin. And in type 1 diabetes, the primary treatment is insulin injections. Type 1 diabetes, we have three classic symptoms. They're called the 3 Ps. It is polyuria, which is excessive urination; polydipsia, which is excessive thirst; polyphagia, which is excessive hunger. Type 1 diabetics, they become very thirsty, they are drinking all the time, and they get extremely hungry. The other two symptoms that typically go along with it are weight loss. So they are eating all the time and they are losing weight. Sometimes the weight loss is drastic. And the other really common complication is extreme fatigue. The complications of type 1 diabetes can be very severe. The acute complication that occurs is called diabetic ketoacidosis. That's a situation where the metabolism, as a result of the insulin not working, the metabolism changes in such a way that we start to build up ketone bodies in the blood. The ketones are acid, so the pH of the blood decreases. The patients become very, very dehydrated. The risk is extremely high. When patients go into diabetic ketoacidosis, they are hospitalized, usually for a period of a few days, sometimes longer than that, depending on the severity of the ketoacidosis. The ketoacidosis can occur when blood glucose levels get typically above 300. Undiagnosed diabetics sometimes get much higher blood glucose levels than that and much more severe ketoacidosis. Complications that can occur are renal disease, heart disease, eye problems that it can actually result in blindness, and neuropathy, which is loss of sensation, especially in the extremities and especially in the feet. Another thing that can occur with diabetes is gangrene, and that is when you hear about a person who has lost a toe or a foot or a leg to diabetes. It is because the gangrene results in that complication. This is one of the reasons why it's so important to take good care of your diabetes, because the chronic complications occur in direct correlation to how well the diabetes is taken care of. For people who are in good diabetic control throughout their lives, they may never get any of those complications. For people who are in poor diabetic control, they may get all of the complications, and again, the complications can be very severe.